during a monitoring mission by the State House Health Monitoring Unit in Manafwa that ended this week. It was discovered that the district houses more than 18 ghost health facilities and over 70 ghost workers. The head of the team, Dr. Julian Nabatanzi, told journalists that their campaigning in the district was a result of the whistleblower by the death of a mother who died in the labor at Bugobero Health Center 4 after being neglected by the staffs on the duty, who allegedly asked for money worth 200,000 from the patient before they attended to her.
Payroll, we looked at their payroll and they have 18 cost centers which actually don't exist. We call those ghost facilities because they don't exist in the district, but they are on their payroll, and they have attached health workers there. They have attached 75 extra health workers in these ghost facilities. So we talked. The cow was I think hadn't dealt with this issue, but we've talked to him and his HR, and they are working with public service to delete and to rectify this issue. So what we are going to do after finding out this today,
Dr. Nabatanza said that as a unit they have discovered 18 ghost health facilities with 75 ghost health workers fully paid by the public service, and also found out that there are rampant cases of the duty negligency by members of the staff at Bugobero Health Center, which is to be blamed for the increased child and marital death at the area.
Payroll, we looked at their payroll and they have 18 cost centers which actually don't exist. We call those ghost facilities because they don't exist in the district, but they are on their payroll, and they have attached health workers there. They have attached 75 extra health workers in these ghost facilities. So
she noted that from February to July so far, 8 children have died and 6 of them have died due to negligency by the staff, and also expressed concern over the poor hygiene of the staff at Bugobero Health Center 4 and absenteeism of the doctors who only attend not more than 5 days in a month.
So these babies, if the tools were being used, they could have been saved. They were to be saved because they were fresh. They died due to delays in the facility, and this can also their absenteeism. Okay, because if you're supposed to be, I remember we looked at again the report of Mbale where in Bugobero there were supposed to be 23 health workers on duty that day. There were only 13. So if you're supposed to be 23 and you're 13, you can imagine. So you will not have adequate people to attend to the mothers or to the patients as they come in. So delays will happen because you have created the understaffing. You are actually creating the understaffing, and you're creating an artificial kind of workload, which is leading to loss of life.
Nabatanzi noted that there is theft and the sale of the government drugs by the health workers in the various health facilities, and forgery of the receipts of about 30 million at the same health center.
About accountability of funds. The facilities don't have vouchers for quite a good amount of money. The accountability files are lacking vouchers, and yet they spent the money. So we are waiting for them to tell us. We have a facility, I think again Bugobero, where the vouchers of 30 million are missing, and that was last financial year. They should have done the accountability. So we need to also look into that. And then infrastructure. They have issues with infrastructure. It's not been very consistent with giving medicine. It had challenges this financial year, which they are actually trying to rectify. But the health workers are stealing medicine. Again, in Bugobero, there was forgery. The storeman is asked to give this quantity, and then he forges and he adds what he wants. So like he was found with extra 2 boxes of artesunate, which he had taken. And we compelled him, and he had to return them to the store. But we are taking on the matter.
Some of the residents who use Bugobero Health Center 4 revealed that the staff at this health center use unprofessional language, which includes abusing of the patients and asking for money to offer services to the locals.
Bunabiro Sibise. Abasawo beeyisa bubi nnyo. Ne bw'ogendayo tebakuwa ddagala ate tebakukebera. Bakugamba bakuyitako buyisi.
Era bw'obuuza omusawo nga ye akambuwala bukambuwazi. Oluusi omuntu n'agamba genda ogule eddagala. Kati n'eddagala oluusi takuwandiikidde. Oluusi agamba genda ogule eddagala teririiwo.
The Manafwa District Health Officer acknowledges the presence of the ghost health facilities and the health workers, but hastened to add that the district is working around the clock with the public service to ease them off the system.